Hey everyone, welcome back to Speak Healthy. Today, we're going to talk about turmeric and 10 awesome benefits of taking it every day. Turmeric is a spice that has been used in traditional medicine for thousands of years, and it's easy to see why. Not only is it a staple in many delicious dishes, but it's also packed with health benefits. From reducing inflammation to improving brain function, the benefits of consuming turmeric are numerous and varied. In this video, we will explore 10 amazing benefits of consuming turmeric every day and why it's worth considering adding it to your daily diet. Number 1. Anti-inflammatory properties. Inflammation is a natural response of the body's immune system to fight off infection, injury, or harmful substances. However, chronic inflammation can contribute to the development of many chronic diseases, including heart disease, diabetes, and cancer. This is where turmeric's anti-inflammatory properties come in handy. Curcumin, the active ingredient in turmeric, has been found to have potent anti-inflammatory properties that can help reduce inflammation in the body. It works by blocking the activity of certain enzymes and molecules that contribute to inflammation, such as cytokines and COX-2. Numerous studies have shown that curcumin can be effective in reducing inflammation in conditions such as osteoarthritis, rheumatoid arthritis, and inflammatory bowel disease. It may also help improve symptoms in people with asthma, eczema, and psoriasis, which are conditions characterized by inflammation. Moreover, the anti-inflammatory properties of curcumin may also help reduce the risk of chronic diseases. For example, some studies have shown that regular consumption of turmeric can help reduce the risk of heart disease by lowering inflammation levels and improving blood flow. Number 2. Boosts brain function. The brain-derived neurotrophic factor, BDNF, is a protein that plays a vital role in the growth, development, and maintenance of neurons in the brain. It's essential for the normal functioning of the nervous system, and its deficiency has been linked to several neurological disorders, such as Alzheimer's disease and depression. Curcumin, the active ingredient in turmeric, has been found to increase the levels of BDNF in the brain. This is significant because it suggests that consuming turmeric may help improve brain function, including memory and cognition. Several studies have investigated the effects of curcumin on brain function, and the results have been promising. For example, a study conducted on healthy older adults found that taking a curcumin supplement for 18 months improved their memory and attention compared to those who took a placebo. In another study, people with mild cognitive impairment who took a curcumin supplement for 6 months showed improvements in their memory and mood compared to those who took a placebo. This suggests that curcumin may have a role in preventing or delaying the onset of cognitive decline associated with aging. Furthermore, curcumin has been found to have neuroprotective properties, which means it may help protect the brain from damage and degeneration caused by oxidative stress and inflammation. Number 3. May lower heart disease risk. Heart disease is a leading cause of death worldwide, and its development is closely linked to several risk factors, including high blood pressure, high cholesterol, and chronic inflammation. The good news is that some studies suggest that regular consumption of turmeric may help reduce the risk of heart disease by improving blood flow and reducing inflammation. Curcumin, the active ingredient in turmeric, has been found to have a variety of cardiovascular benefits. For example, it may help reduce the risk of heart disease by improving endothelial function, which is the ability of blood vessels to dilate and contract properly. This can help improve blood flow and reduce the risk of high blood pressure and blood clots. In addition, curcumin has been found to have anti-inflammatory properties that can help reduce inflammation in the body, including inflammation in the arteries, which is a risk factor for heart disease. It may also help reduce the levels of LDL or bad cholesterol in the blood, which can contribute to the development of atherosclerosis, a condition characterized by the buildup of plaque in the arteries. Several studies have investigated the effects of curcumin on heart health, and the results have been promising. For example, a randomized controlled trial found that taking a curcumin supplement for 8 weeks improved endothelial function in people with metabolic syndrome, a condition that increases the risk of heart disease. Moreover, a review of 9 studies found that taking curcumin supplements significantly reduced levels of LDL cholesterol and triglycerides, another type of blood fat that can contribute to heart disease. Number 4. May reduce cancer risk. Cancer is a complex disease characterized by the uncontrolled growth and spread of abnormal cells in the body. The development and progression of cancer are influenced by many factors, including genetic and environmental factors, as well as lifestyle factors such as diet and exercise. One of the promising dietary components that has been studied for its potential anti-cancer properties is curcumin, the active ingredient in turmeric. Curcumin has been found to have a variety of anti-cancer properties, including the ability to inhibit the growth of cancer cells and induce apoptosis, or programmed cell death, in cancer cells. It has also been found to have anti-inflammatory and antioxidant properties, which can help reduce the risk of cancer by reducing the damage to DNA and other cellular structures caused by oxidative stress and chronic inflammation. Several studies have investigated the potential anti-cancer effects of curcumin, and the results have been promising. For example, a review of 44 studies found that curcumin inhibited the growth of cancer cells in laboratory and animal studies, and that it had the potential to prevent or delay the progression of several types of cancer, including breast, lung, and prostate cancer. Moreover, some clinical trials have investigated the effects of curcumin on cancer in humans, and the results have been encouraging. For instance, a study involving 25 patients with colorectal cancer found that taking curcumin supplements for 30 days led to a reduction in the number of cancerous polyps in the colon. However, it's important to note that more research is needed to fully understand the potential anti-cancer effects of curcumin, and it should not be considered a replacement for conventional cancer treatment. Nevertheless, the promising results of the studies suggest that consuming turmeric and curcumin may be a useful dietary strategy for reducing the risk of cancer and improving cancer outcomes. Number 5. Arthritis Improvement. Arthritis is a common condition characterized by joint inflammation and pain, and it can have a significant impact on quality of life. Although there are many treatments available for arthritis, including medications, physical therapy, and surgery, many people also seek natural remedies to manage their symptoms. Turmeric, and specifically curcumin, has been studied for its potential to help manage arthritis symptoms. Curcumin has been found to have strong anti-inflammatory properties, which may help reduce joint pain and stiffness associated with arthritis. Inflammation is a major contributor to the development and progression of arthritis, and reducing inflammation can help improve joint function and reduce pain. Several studies have investigated the potential anti-arthritis effects of curcumin, and the results have been promising. For example, a randomized controlled trial found that taking a curcumin supplement for 8 weeks led to significant reductions in joint pain and improvements in joint function in people with osteoarthritis, a common form of arthritis. Another study found that taking a combination of curcumin and boswellia, another natural anti-inflammatory herb, led to significant improvements in joint pain and stiffness in people with rheumatoid arthritis, another type of arthritis characterized by chronic inflammation. Moreover, a review of 14 studies found that taking curcumin supplements led to significant improvements in pain and physical function in people with osteoarthritis and rheumatoid arthritis. Number 6. Digestion Improvement. Digestive issues, such as bloating and gas, are common and can be uncomfortable and disruptive to daily life. Turmeric has long been used in traditional medicine to improve digestion, and recent research has started to explore its potential digestive benefits. Turmeric contains compounds that may help stimulate the production of bile, a substance that aids in the digestion of fats. It may also help reduce inflammation in the digestive tract, which can improve digestion and reduce symptoms of digestive discomfort. One study found that taking a combination of turmeric and ginger supplements for 4 weeks led to significant reductions in bloating and gas in people with functional dyspepsia, a common digestive disorder characterized by pain and discomfort in the upper abdomen. Another study found that taking a curcumin supplement for 8 weeks led to significant improvements in symptoms of irritable bowel syndrome, IBS, a common digestive disorder characterized by abdominal pain, bloating, and changes in bowel habits. Moreover, a review of 12 studies found that taking curcumin supplements led to significant improvements in digestive symptoms, including bloating, gas, and abdominal pain, in people with various digestive disorders. Number 7. Skin Health Improvement. The skin is the largest organ in the body and plays a vital role in protecting against environmental stressors and regulating body temperature. Turmeric, and specifically curcumin, has been studied for its potential to improve skin health and reduce the signs of aging. Curcumin has been found to have strong anti-inflammatory properties, which can help reduce inflammation in the skin and improve skin health. Chronic inflammation can contribute to a range of skin issues, including acne, psoriasis, and eczema, and reducing inflammation may help improve these conditions. Curcumin has also been found to have antioxidant properties, which can help protect the skin from damage caused by environmental stressors such as UV radiation and pollution. Antioxidants can help neutralize free radicals, which are unstable molecules that can damage cells and contribute to the development of various diseases, including skin aging. Several studies have investigated the potential skin health benefits of curcumin, and the results have been promising. For example, a study found that applying a cream containing curcumin and niacinamide, a form of vitamin B3, led to significant improvements in skin texture and hyperpigmentation in women with aging skin. Another study found that taking a curcumin supplement for 12 weeks led to significant improvements in skin elasticity and hydration in middle-aged women. Moreover, a review of 13 studies found that curcumin supplementation and topical application led to significant improvements in various aspects of skin health, including hydration, elasticity, and the appearance of fine lines and wrinkles. Number 8. Diabetes management. Diabetes is a chronic condition characterized by high blood sugar levels and impaired insulin function. Insulin is a hormone that plays a crucial role in regulating blood sugar levels, and impaired insulin function can lead to a range of health problems. Several studies have investigated the potential blood sugar lowering effects of curcumin, and the results have been promising. Curcumin has been found to have anti-inflammatory properties, which may help improve insulin function and lower blood sugar levels. One study found that taking a curcumin supplement for 3 months led to significant reductions in fasting blood sugar levels and hemoglobin A1C levels, a measure of average blood sugar levels over time, in people with type 2 diabetes. Another study found that taking a curcumin supplement for 9 months led to significant improvements in insulin sensitivity in people with prediabetes, a condition characterized by high blood sugar levels that are not yet high enough to be classified as diabetes. Moreover, a review of 9 studies found that taking curcumin supplements led to significant reductions in fasting blood sugar levels in people with type 2 diabetes. Number 9. Immune function boost. The immune system plays a crucial role in protecting the body against infections and diseases. Turmeric, and specifically curcumin, has been studied for its potential to boost immune function and improve overall health. Curcumin has been found to have strong antioxidant and anti-inflammatory properties, which can help support the immune system by reducing inflammation and oxidative stress in the body. Chronic inflammation and oxidative stress can contribute to a range of health problems, including immune dysfunction, and reducing these factors may help improve immune function. Several studies have investigated the potential immune-boosting effects of curcumin, and the results have been promising. For example, a study found that taking a curcumin supplement for 8 weeks led to significant increases in immune cells called natural killer cells in people with colorectal cancer. Another study found that taking a curcumin supplement for 6 weeks led to significant improvements in immune function in healthy elderly individuals. Moreover, a review of 19 studies found that curcumin supplementation led to significant improvements in immune function in people with a range of health conditions, including rheumatoid arthritis, cancer, and respiratory tract infections. Number 10. Mood improvement. Depression is a common mental health condition that can have a significant impact on an individual's quality of life. While there are several medications and therapies available for treating depression, some people may also seek natural remedies, including curcumin. Studies have found that curcumin may have antidepressant properties and may help improve mood and reduce symptoms of depression. One study found that taking a curcumin supplement for 6 weeks led to significant reductions in symptoms of depression in people with major depressive disorder. Another study found that taking a curcumin supplement for 8 weeks led to significant improvements in mood and cognitive function in healthy elderly individuals. Moreover, a review of 6 studies found that curcumin supplementation led to significant reductions in symptoms of depression in people with major depressive disorder. The exact mechanism by which curcumin may improve mood and reduce symptoms of depression is not fully understood, but it is thought to be related to its anti-inflammatory and antioxidant properties. Chronic inflammation and oxidative stress have been linked to the development of depression, and reducing these factors may help improve mood and reduce symptoms. As you can see, consuming turmeric on a regular basis can have numerous health benefits. These benefits are largely attributed to the presence of curcumin, a compound found in turmeric. However, while the potential health benefits of turmeric are promising, it is important to note that more research is needed to fully understand its effects on human health.